𝗦𝗢𝗖𝗜𝗔𝗟 𝗦𝗢aptmumk Anangkwe Nation Nation Treaty 3 𝗦𝗢𝗔𝗟. Hi, my spirit name is Star Woman. My English name is Charity, and I am Anishinaabe from Treaty 3. I'm also Romanian and Scottish, and I'm presenting this on behalf of myself and my esteemed colleague, Reid, who was the person who delivered these interventions. And this is her case example based on teachings and training that I've delivered and which we integrate into our services at Qualia Counselling Services as invited guests into Six Nations of the Grand, but also with a clinic in Brantford, which we serve a large urban Indigenous population. We also have clinics in Waterloo and Guelph. So we're excited to showcase this case example primarily with the intent to contribute to dialogue and idea generation about how Indigenous adapted structured psychotherapy can be used and delivered, and especially in this context to support women's reproductive mental health and also just Indigenous women's experiences, and in a way that honors culture. As you may know, if you've done a literature review for Indigenous adapted structured psychotherapy, there are very few publications and published studies, and so we need a growing amount of literature. We also need a growing amount of Indigenous clinicians and psychologists, psychotherapists who are recruited and retained and supported so that they can contribute in leadership of this work. This particular case example is a traumatic birth, a PTSD, and postpartum or perinatal depression case example of Skye, a 28-year-old Indigenous mother who self-referred, experiencing distress primarily. She was pregnant and was considering termination of the pregnancy, not because she wanted to terminate the pregnancy, but because the level of distress related to a traumatic birth from her previous pregnancy and really daunting experience of anxiety and depression. The measures that were administered were the PTSD symptom scale interview, the Edinburgh postnatal depression scale, and the adverse childhood experiences questionnaire, all of which had significant results. And right from the beginning, the focus was really this 𝗦𝗢aptmumk or two-eyed seeing case conceptualization, which integrated understandings not only of the diagnoses that Skye had and her current presentation of symptoms, but a historical and intergenerational trauma perspective, anti-Indigenous systemic racism understanding as to how those were also contributing to health inequity and barriers to health and mental health access. 𝗦𝗦aptmumk, it focuses on the integration of these understandings, but also is a strengths-based focused rather than maybe a more traditionally in psychology and mental health, a more deficit-based approach. We see a need for balance there as well in terms of understanding, of course, from that quote-unquote deficit-based approach, but also the integration of strengths and culture. And so using Indigenous adapted CBT interventions and worksheets, Susan was able to deliver CBT, but in a way that honored and integrated cultural teachings. Especially important in this case example, and among the Haudenosaunee, a teaching that we really focus on is 𝗦𝗢𝗖𝗓𝗓, teachings of the good mind, embracing a good mind for strength, for peace, for empowerment, and teachings that focus both on spiritual and relational aspects of self and strength, and really integrating these these cultural teachings with a focus on accomplishment and empowerment and victory and courage to process trauma, narrative, and reminders, memories. Sue was able to deliver these as well using emotion regulation techniques that were land-based, a focus on generational healing, and other strengths-based approaches were integrated for the delivery of these interventions and treatment. The result, we thought, was pretty dramatic and life-changing, both for Skye and for us as clinicians to be able to observe. Skye was able to give birth to her third child in a way she reported honored her heritage, her need for birthing supports, and without distress. Post-treatment measures showed a decrease in symptoms that she presented with. But most encouraging is this intergenerational impact of strength of seven generations teaching of healing and of cultural reclamation. Of course, this is one case example. We're presenting to, again, support discussion and dialogue and idea generation about how to adapt CBT and structured psychotherapy to support Indigenous peoples, but a lot more research needs to be conducted and publications to continue to support this dialogue. Miigwech, please visit us at Qualia Counseling Services. The QR code will take you to the website if you want to contact us or find out more. Again, my name is Charity, and Susan Reid is my co-presenter at Qualia Counseling Services. Miigwech.